Okay, we're continuing with this book here, Prevent and Reverse Stroke and Heart Attack by me, P. Rogers. If you're following along, let me give you the page here. We just did the part on Caldwell-Esselstyn, and we're on page 35. Okay, so a couple words on oil. One of the things I like about Dr. Esselstyn and Dr. McDougall is they don't wimp out. Okay, you don't want to wimp out. The people who wimp out, they're not giving you the best advice. Because a lot of people know you're more popular on the internet, you get invited to more channels if you tell people you should reduce your intake of oil, or you say BS, olive oil is okay, but it's not the truth. No oil, not one drop. Dr. Esselstyn's famous for saying that. No oil, not one drop. McDougall says the same thing, agrees with him. I agree with him. That's what you want to know. Here's Esselstyn quote, "Oil is toxic to your arteries. Do not eat anything with oil in it. Moderation kills. You only see heart disease in countries that eat a lot of meat and oils. Coronary artery disease is a foodborne illness. No oil, not one drop." Okay, that's an important point. You don't win the health victory by being a wimp. An alcoholic doesn't get better if they drink on the weekends. Okay, and half-assed doctors and outright liars are not helping the patients, telling them that olive oil is good for you. That's ridiculous. They sold out to the companies. There's some doctors that receive over $1 million a year as a reward for promoting olive oil, saying it's heart healthy and stuff. It's big business. That's $1 billion food product. Okay. The average patient, I know patients, man, I feel sorry for them, but most of them are so clueless. They believe anything you tell them, literally anything. You can tell them, olive oil is good for your arteries, and they believe that. They're so ignorant, it's unbelievable. Okay, another thing to realize is, it's been my experience, the average person sort of thinks the doctor's there to take care of them, the hospital or the doctor care about them. No one cares about you. You're just a peasant, okay? The medical system runs on atheistic Darwinism, which says that you are just a monkey that talks. Okay, atheistic Darwinism says a human is a monkey that talks. You have no rights. They have no obligation to you. Their obligation is to the insurance company, to Big Pharma, to the standard of care protocols. That's it. You don't really matter. And you need to know that. Once you realize that no one cares at all about you, as long as they follow the standard protocol, if you die on the spot, die tomorrow, who cares? You don't matter, you stupid talking monkey. Okay, you need to know that, because once you get that, you just have to realize you should use the healthcare system to see what you can get from it. The doctors sometimes know some very useful information. They have a lot of experience. Okay, it's like the quote of Voltaire, "I want my doctor and my tailor to believe in God so they do not rob me." The joke by Anton Chekhov, "What is the difference between a lawyer and a doctor? A lawyer will rob you, but a doctor will rob you and kill you." So you got to be careful. I'd say same thing for a dentist. Dentists are dangerous. Okay, now here's a picture of coronary artery anatomy. And the relevance is that typical anatomy is the left main coronary artery, comes off the aortic arch. These are the epicardial coronaries on the outer surface of the heart, the big ones. These are the ones you see at cardiac cath, coronary angiogram. Left main coronary artery bifurcates into the circumflex, left circumflex, and the left anterior descending. This runs over the anterior surface of the heart. This runs around to the side of the heart. Okay, they take a catheter, they run it up from the common femoral artery into the aortic arch, and then they catheterize the left main, squirt some contrast in there, they can see the LAD and the circ. And these are the big arteries proximally where they'll put stents in, they'll do surgical bypass grafts. You get an atherosclerotic plaque on the left main, that's called a widowmaker. All right, but the reason I'm showing you this is to show you a normal variant. This is called the ramus intermedius, and that's a third branch. So you get, in these patients, a trifurcation instead of a bifurcation. And what that means is that the LAD and the circumflex are going to be smaller. And when they're smaller, the smaller the artery, the harder it is to put a stent in it, the harder it is to put a bypass graft and have that bypass or stent stay open. So the point is, you don't know if you don't have a ramus branch. You don't know what your coronary artery pattern is. And so number one, you might have a lousy pattern for stenting and bypass. Number two, like I told you about the William Roberts paper, it's always diffuse. So even if they bypass the proximal stenosis, so what? You're going to have diffuse disease distally. What about your intramyocardial branches that penetrate into the heart muscle? What if you got disease in those? You can't treat those with a stent. You can't treat those with a bypass. So the point is, there's only one way to treat this effectively, diffusely, and that's with a healthy diet. You can try with drugs, but the diet works a lot better than the drugs. Once you understand that, you realize, the futility of the other stuff, so you can do the smart move. Okay, here's a paper. Ramus intermedius increases the risk of atherosclerotic plaque formation at the left main bifurcation. Okay. All right. All right, next chapter will be hypertension. So, anyways, that was the point for today. Once you recognize there is no way out, there is no escape, no one else can save you, you have to save yourself. And the only thing that works well is a low-fat vegan diet. It's like, why wouldn't you do it? It's a no-brainer. Because people ask me all the time, should I get a cardiac calcium CT, cardiac CT angiogram, all this stuff? I'm like, are you a low-fat vegan? They go, no. I'm like, well, why not? Well, I don't know if I have coronary artery disease. Bullshit. Yes, you do. If you ate a Western diet, if you ate this Mediterranean diet, standard American diet, you've got coronary artery disease. You don't need to check. And I don't care if there's calcium or not. You've got coronary artery disease. And you know what the treatment is. And you know how you prevent hypertension and diabetes and coronary artery disease. The low-fat vegan diet, no oil. So why don't you just do the diet and stop bullshitting around with all these tests? Everybody wants to, do another test, do another test, do another test, do another test. Hardly anybody wants to do the only thing that cures it. That's the smart move. You don't cure a disease by taking a picture of it. You cure it by fixing your diet and avoiding the other toxins. I've talked about that stuff. It's also helpful. Avoid the mitochondria inhibitors, avoid the estrogenic chemicals, etc. Okay, hope you found that helpful.